Well, welcome everyone. It's really great to have people listening, watching us. What we're here today to really think about is the conversation around Youth SBIRT and why it's important. I'm Maura Gaswirth. I'm the director at the National Council for Mental Wellbeing, and I'm joined with three of my colleagues who will introduce themselves in a minute and kind of their connection to this work. But we really hope to share why Youth SBIRT is important, why we should continue talking about it, thinking about it in the community, some successes and challenges, and really the trends that we're seeing. So we look forward to our conversation today. So I'm going to start off with Laura. If you want to introduce yourself and a little bit of your work with Youth SBIRT.
Yeah, thank you so much for having me. I'm Laura Leone. I am an integrated health consultant here at the National Council for Mental Wellbeing. I've worked in the field of integrated health for over 20 years before becoming a consultant. And during that time, had firsthand experience learning and understanding SBIRT, screening, brief intervention, and referral to treatment. And now I have the pleasure of helping others to learn the process and really helping them to expand it now to our youth population, which is really exciting.
Thank you. And Aaron?
Hi, everybody, and thank you all who are watching or listening to this. So I'm Aaron Williams, Senior Advisor here at the National Council for Mental Wellbeing. I've been with the National Council for about 10 years now, doing lots of integrated health work with a particular focus around the integration of substance use services and primary healthcare services. I've been around the field of substance use for nearing about 17 years now. And I'm really excited now just to see all the progress we've made with integrating substance use services, SBIRT and the like into primary healthcare settings. And, really excited to see it expand, see us, do some more deep thinking about, how we integrate these services for youth. So I'm happy to be here today.
Thank you. And Pam?
Hi, I'm Pam Pietruszewski, also a senior advisor here at the National Council. And doing SBIRT work was one of the first things I did when I came here about 7 years ago. I had come from an environment where we implemented SBIRT in a bunch of primary care settings who had also implemented depression screening and wanted to take on another integration topic. And so substance use seemed like a good next step. Had also done some integration in the criminal justice system. Since being at the National Council, we've implemented this for a number of OBGYNs and others in the perinatal space. And the adolescent population is one that might be my favorite. So yeah, really excited to be here.
Thank you all. I'm so excited to join this conversation with all of you and really learn and for us to share with those that are listening and watching about really the importance of Youth SBIRT and why we find it important. So that's kind of like the first question, and want to hear from all of you thinking about why is Youth SBIRT important, right? Why is engaging youth, thinking about prevention and youth mental well-being, really? Why is this important for us to be thinking about and thinking about it in some of the spaces that those that are listening are from, integrated health settings, all of those places. And so I'm curious what you guys think about that, or how you would narrow that down if someone said, why Youth SBIRT?
I feel like I should start since I said this is my favorite area. I'll just start that, the first thing that comes to mind for me is that we adults in whatever type of health setting or social service setting, if we're interacting with young people, it's such an opportunity to impact the trajectory of their life, really. I mean, if we are going to try and help people become healthy adults and achieve that, amount of well-being that we all want, it starts with young people. And these are those ages where they are exposed to substances and they're dealing with relationships and they're thinking about who they are as people. And so how can we normalize these conversations, make this a routine part of service delivery in whatever way we are? It can just have such an impact it's kind of mind blowing if you think about it.
Yeah, I mean, it's really an opportunity to also normalize the conversation around substance use and around, the hope of either preventing use or misuse and encouraging healthy or healthier ways of living. And it starts with that open conversation. It starts with normalizing it and making it routine. And I think Youth SBIRT has really the opportunity to do that and help people to adapt to that conversation in a new and different way.
Yeah, I just to add to what Laura and Pam have suggested. I also tend to think about there is lots of data now that really suggests that the more you can delay onset of use or significant use of substances, the better off people will be, right? There's a lot of data from NIDA and other organizations, looking at, when people first start using and sort of what their substance use disorder trajectory ends up being. So, those who delay the onset of first use, they end up having less problems with substances. And those that do end up using substances or having some issue, they resolve them quicker. So I think, the data is really suggesting kind of what, Laura and Pam are talking about, that, lots of benefits to delaying use, to starting those conversations early, and really thinking about substance use and addressing substance use at an early age as being critical to long-term mental well-being.
And I think if I could add sort of one more piece to it, I think what we find, Pam, Aaron, and I, is that when we're working with organizations, very often they're doing pieces and steps of the SBIRT process already. But I think what is wonderful about the SBIRT model is that it is a model and approach to cohesively matching the steps together and really allowing for staff to feel confident and competent in proceeding with their screening, then brief intervention or brief conversations, and then that referral to treatment process in a very specified and structured way that helps people really deliver it in an optimized way to our youth. So I think there's a benefit to that.
Thank you all. And I think, Laura, that's a great segue to the other thought of what trends are you all seeing when you're coaching, consulting on SBIRT, right? Youth SBIRT. What are you seeing? I'd love to hear some of those trends and thinking about both from the successes and maybe what are some of the challenges that organizations, providers are facing.
I can jump in here and just sort of start. I think one of the trends I'm, really seeing and kind of, pleased to see is that there is interest here. So, health centers, organizations are interested in, doing something, screening related to youth and, putting forward, the SBIRT model for youth. I think we're seeing sort of uptick in people sort of asking about it. They're looking at our resources related to it. And you really see, I think, people sort of getting the value of, having some ability to provide some of these services now. So I think that's a positive trend that's happening and moving in the right direction. So that would be the first thing sort of jumps out at me.
And I would say what helps that as well is that I think young people more than ever are helping to break the stigma associated with, anxiety and, sobriety and all of these things that previous or other generations we maybe didn't want to ask about or didn't want to acknowledge we were struggling with. And so in a way, young people are leading the path and they're expecting us to show up for that. So why not be there for them when they are maybe feeling less stigma? There's still stigma, but they're, I think, really making a difference in that we want people to talk with us. They need and they want, I think, trusted adults to bring this up if they aren't going to bring it up, or to show that they're ready when a young person's ready to talk about it.
And I think when a team is starting that process and embarking on it, really helping to coach the staff who are going to start the screening process as to the why, and as to sort of that piece that you were just speaking about, Pam, that, this is an opportunity. Here's the why behind the work that we're doing, why we're asking these questions, and normalizing it for them. Sometimes it does feel even more normalized for the youth than it does for the staff that are adults delivering the process and working through the model. So helping to coach from the very beginning as to the why and what to say, role playing and sort of practicing and having scripts to then work off of, all of that, I think helps with the success of the model too, especially for new teams just starting.
And, to be fair, one of the other trends, unfortunately, that we see, to also talk about what's making this hard, is competing priorities, which has always been a challenge. There's so much, I think, being put on health providers and organizations. And then you add COVID to that and all of the competing priorities that has brought about, that it does make it hard for folks to say, this is the right thing, but we just can't commit to going all in. Or how do we do this in the midst of a pandemic? It's like people want to do it, and yet those competing demands have always been making it tough.
Yeah, Pam, to kind of go along with that, I think, organizations are sort of find it difficult to find sort of that right workflow, that sort of perfect workflow that sort of meets all of their demands and the demands that are being put on them. How do you implement this in a way, where it doesn't take particularly long, right? So we know, providers, I think what is the number we've seen, providers spend about 8 to 10 minutes with a person and that's it. So how do we get the necessary screens and checks in place, and referrals, for this in place within that short span, knowing they have to do other and provide other services during that 10-minute window or so. So that's always, something that comes up in the conversation. Hey, we're strapped for time, or, there's a level of productivity that we have to meet. So we want to do this, but we want to make sure it doesn't slow us down. And, we have to think sort of uniquely about what's going on in any particular place and how to help them implement something that will, keep them moving forward, in a way that maximizes patient health and good outcomes, but also doesn't slow down productivity.
And I think helping them to realize that you don't have to wait for everything to be perfectly in place to start, right? Like that is, I think, part of the key to this is realizing that it's sort of a quality improvement process, plan, do, study, act, and really thinking about how you look at what you're doing, look at what's working well, and then tweaking or changing what needs to be so that the youth SBIRT process really works for that particular organization. I do think, starting off with a team, sort of a designated core implementation team, is something that can really help the process be successful. So really thinking about, who in the organization or the program or the department, wherever, youth SBIRT is going to start, to really think about having a variety of different people, different staff and staff roles, who are going to be responsible for the different steps of the model, right? The screening, the brief intervention, and the referral to treatment, to understand who's going to be doing that or having a role to play in that. And then making sure to have a champion person or people that can, start to work on this and pilot it and give good open feedback, but are willing to try. I think those are some, key sort of ingredients to the success of the team and to the work starting out. I think as I'm pondering some barriers, I don't know so much if it's a barrier as a consideration for teams, but we're seeing now more thoughts and concerns specifically to working with youth around provider alone time with the youth, and just considerations around when and how to ask questions around an adolescent's substance use, and whether to do that in the visit with that person's either caregiver or friend or whomever might be accompanying that client, versus doing that sort of separately and alone with the youth. So there's some considerations there, and some different thoughts as to how to make that happen. But I know that that's something that teams are, kind of come up against and are thinking through.
Yeah, that's a good point, that is something that makes this very different from adult SBIRT and with some other populations is, do you get some time alone with the adolescent? Will they acknowledge or talk a bit about substance use if there's a parent or caregiver overseeing the screening? And it's another reason why it's what's nice about it is it's, hopefully we're always thinking about that anyway if we're in an organization, because there are other sensitive topics that, we want adolescents to feel like they can talk with us about. So for some people, this is a reminder of, we need to go back and see what is our confidentiality expectations, what is our workflow, and when do we ask that caregiver to step out of the room, or do we take the young person back first? And as Erin mentioned, the workflows. So how do we smooth out our workflows so this doesn't feel like it's interrupting our flow or the way the patient is used to receiving care too?
Definitely, I think, those confidentiality issues are, pretty big when we talk about, adolescents. But I also think, as many organizations have talked about, helping youth begin to think about healthy sort of healthcare habits, having them at a very young age begin thinking about, my mental well-being, my substance use. They are all part of health, right? So we should be asking questions about how they're doing, mentally, about sort of what they're using, if they're using anything related to substances. That's something that happens. It's not uncommon that people use substances. So from a healthcare perspective, we would want to take that in consideration and ask questions about that so we can understand that. We know, substance use is highly implicated in a host of other health conditions. So, why not begin with youth at a younger age, helping them begin to think about how they can take ownership of their health, right? How they can take ownership of, what may be going on, and sort of doing that as a part of that, confidentiality concern, right? So, maybe it is appropriate to have a little bit of alone time to talk through some of those issues as a way to promote people taking real, ultimate, eventual control of their own sort of healthcare. So a few minutes here and there, might be, helpful for the long term.
I like that you just said that a few minutes here or there, because what SBIRT also is it's not meant to be a one and done. And, we checked the box that we asked about drugs and they said no, and good, we can put that aside. It's meant to be an over time culture shift for an organization and for patients to expect, this is part of what constitutes my overall health. And, maybe it's a short conversation today, but what we've seen in a lot of organizations is when these adolescents and young people feel like they can trust and they are in a space where they can acknowledge use if there's use, it might be something they bring up at a later appointment. As long as we're keeping the door open, rescreening, oftentimes it's something that they mention later, or they're maybe only 12 years old now and not using, but they're going to be 13 and 16 and 17. And so it's meant to be the long view of a lot of short conversations, a lot of showing we're open and interested in knowing all about the things that make you healthy and well. And not just a simple one and done and we've solved everything.
Yeah, I mean, it really is about that engagement work, right? And use of motivational interviewing and the motivational interviewing spirit of partnership and evocation, empathy, and acceptance with the youth, and being able to have that continual, like you said, open door and conversation. And it might not be the first time, the second time, or the 10th time that you ask. But eventually that youth will engage and feel open enough and forthcoming enough, hopefully, to share, right? And it's not about being resistant, or some of the things that people, staff sometimes start to think. It's really about that comfort and that engagement level, and then again being forthcoming, or just when something does happen, that they feel willing to share that with their healthcare staff, their behavioral health staff, whomever they're working with.
It's clear the three of you have such a passion for this work, and really the importance of it, but also what you're seeing and how the trends, there's such success, right, from the organizations that you've worked with, but it takes time. And so Laura, I think I loved when you said that it doesn't have to be perfect, right? And so how do you do the PDSAs? Those, our continuous quality improvement is a part of this, and then that whole person approach, and how are we teaching youth at a young age to really be engaged in their own healthcare. And finding safe, trusted adults. I think that's huge for teens and youth, right? And so I'm wondering, is there anything else that you guys would message around Youth SBIRT, this work, for organizations that are listening in and thinking, maybe where I get started, but just what would you leave people with, right, after listening to kind of the importance and these trends that we're seeing for organizations to go next? Or even what they could do internally to think about, how do we take the next step into all of this?
Well, I think it's not a one size fits all model. Like, I think, there are many different ways to do SBIRT. And, I think sometimes there's a fear that there's a rigidity around the structure of how to do that, and who's going to do sort of the different steps of the process. So I would just let people know that there's, you can be kind of creative and look within your system to make this work. And that it very rarely takes as long of a time as people really think it does, because again, this is a model that's for general population. You're not going to be every other patient or client sending them to a detox or rehabilitation unit, right? Like this, it's for talking about just everyday use. And especially in our youth population, there's far less youth that are using substances than even adults. So you're going to, as you screen, see less positive screens even. So just those would be some tips I would say.
Yeah, I think, similarly to that, I guess the first thing I would say to people is, that this is doable. I know with all the competing priorities, it may seem daunting, but there is, a lot of work out there, resources, certainly our resources and others, that can help you along this path. And it certainly is worth it. The data, I think, is pretty clear. That the more people within the healthcare establishment that are willing to ask questions and intervene around substance use issues, the better. The more people have opportunities to access, needed services and to engage. Maybe they aren't willing to, go to a treatment center just yet, but maybe they are willing to talk with someone on your behavioral health staff in the health center. So, or maybe they're willing to have a conversation with a peer recovery specialist. Well, you don't really know those things unless you're doing the screening and asking some of the questions. And it really is a good, way to, I think, engage people, within, the context of these services. The other thing I would think about is that, we should all keep in mind that very often whenever providers asking about this, it's really the first time anybody in the position of authority has ever asked them about this very often. So there may be a little bit of uncomfortableness, initially, but it's important you keep doing it, keep asking, so that people become more comfortable with this as a routine question. Again, these are things that are not uncommon, so we ought to be, operating in the space as such. So I just think, those would be the kind of the key things I would talk about initially for folks.
Yeah, I guess the only other thing I'll add is, this is prevention and early intervention. So I think a lot of places are hesitant, as Laura said, because they think they've got to have like all the information about detox, and they need to know, where all the substance use treatment providers are. And while that is part of the model, that's the RT, the screening rates skew much earlier, right? So most of these young people are going to either accurately let us know they're not using, or just hesitantly say they aren't using because they're not used to being asked. And we might not be used to asking the question and knowing how to handle that. And so the better we get at having those conversations, engaging with them, if we learn about use, we can do some early intervention. And for those that do report substantial use, we want to have the right referral process for that. But it's so much more about prevention and early intervention, because that is where the numbers lie anyway. And so what an opportunity. Why wait? Why are we don't do that for other health conditions. I always talk about how your blood pressure is taken every time you go to your doctor for pretty much anything, because it's such an important vital sign that can tell you about some other health issues. Why would we wait to talk about this or to learn about where someone's at with this until they're much further down the road? So universal screening, asking everybody, making an environment that feels safe and comfortable. These brief interventions don't have to be long and extensive. They are brief. And then really using the full team, whomever is on your team, to say who can do what parts of this, who does know some of our referral agencies that we can coordinate with, who has a good relationship with patients that can also be part of a brief intervention process. As to what Erin said, can make it quite doable and quite meaningful.
And I guess I feel like this is a great opportunity to also say, if we're going to be helping organizations who are embarking on doing this, you were in luck, because all of us here at the National Council for Mental Wellbeing, in collaboration with the Conrad and Hilton Foundation, created what we call the Improving Adolescent Health Facilitating Change for Excellence in SBIRT, which is a change package toolkit of sorts that has all sorts of information, so much more than what we're even sharing today, about tips and tricks and how to really do youth SBIRT in a really wonderful and successful way. So we definitely want to encourage you to check that out as well.
And I love to mention that it was created by a bunch of experts around the country and then used by a bunch of health centers who gave us feedback after using it. And then we went back and made revisions based on real world experiences of what works, what doesn't, where do you need to think about adapting, where should you stick with what we know is most likely to work. So yeah, it's I highly recommend it.
Yeah, and Pam, to your point, there were 13 different health centers that we utilized as a part of that pilot, and almost every one of them was able to implement and improve their screening, to go from really not screening any youth to screening pretty much all youth, or all of their target population of youth. So I think there was some success, that we went back and tweaked the change package a little bit over. And so now we have, I think, a great version of that resource that's available, thanks to the hard work of other, health centers and organizations that we, similarly situated. So, it's exciting. And again, I think it is something that the field really needs in terms of, how to, looking at implementation of youth SBIRT on a broader scale.
Thank you all for that. And I think it's a perfect opportunity to say we can't wait to continue the conversation with one another, with the National Council, with all of you who are, again, listening in, reading, watching, right, who want to really continue this conversation. Access the resources. Let us join in with you in this process. And we really look forward to doing that with you. So thank you. And thank you, Erin, Laura, and Pam. It's always so great to hear your passion behind this work. So thank you. And we'll continue the conversation.